All right, so we're looking at what is known as developmental delay in fetus. All right, so the name actually just tells everything about the concept, you know. So developmental delays just have to do with, maybe a baby is supposed to grow to this level, but that time is at that time, but the baby hasn't reached that level yet, you know. So developmental delays in fetus just refers to what? A slower than expected growth, all right, or like the baby is not maturing physically, all right, cognitive, not able to attain that level of intelligence, starting to know things, or neurological symptoms during pregnancy, so it can be dictated through prenatal screenings and maybe a signal that the baby is likely to have one of these issues that will be listing. Do you understand? So it can stem from a variety of factors. If you see it is not a disease condition, it's only pointing that there is a disease condition. So chromosomal issues like trisomy 13, trisomy 18, trisomy 21. Maybe the mother has some infections, like maybe Zika virus infection, Rubella infections, cytomegalovirus infections. Maybe she has been exposed to some toxins, alcohol, tobacco, drugs, lead. Poor maternal nutrition, all right, premature birth or low birth weight, lack of oxygen during pregnancy or delivery. Okay, so signs and dictation is this: if the fetal growth is below expected norms on an ultrasound, if you are checking the amniotic fluid and it's basically abnormal, the levels are too much, that's what oligohydramnios, or too little, that's what oligohydramnios. If there's delayed organ development, so there's some particular organ that is supposed to develop at this stage, and even at that stage you're not having it. Elevated alpha fetoprotein, structural anomalies. All right, if you do all those imagings, then you're seeing issues with the structure and all of that. Diagnostic tool is ultrasound, amniocentesis, fetal MRI, then non-invasive prenatal tests. So potential outcomes is for a person to not develop according to the timeline. When you give birth to that person, when they grow, they have issues with what? Intellect. They have motor or speech delays, congenital anomalies. They can be giving birth to death. All right. There's need for what? Neonatal intensive care. Okay.